Hi viewers, in this video we will talk about the hormonal causes of elevated blood pressure. So elevated blood pressure or hypertension is a silent killer like diabetes, and uncontrolled blood pressure over a long period of time leads to increased cardiovascular complications. So the most common cause of hypertension is essential hypertension, usually caused by the lifestyle related factors along with some contribution from the family history and genetics. But there are situations wherein the hypertension is caused by other etiologies like kidney disease or the other common reason for endocrine cause or a reason for hypertension are hormonal disorders. So there are many hormonal disorders which can cause elevated blood pressure. To name a few, excess or deficiency of thyroid hormone or growth hormone, an excess of aldosterone hormone, an excess of cortisol hormone are few of the causes. Of these, the common causes that we see are usually the BP fluctuations in thyroid disorders are minimal. Significant elevated blood pressure, like the common hormone cause that we see is excess of a hormone called as aldosterone, which is produced by glands which are situated in abdomen called as adrenal glands. So when should we suspect the suspect a secondary cause of hypertension? So there are certain pointers wherein we should think of hormonal etiology of hypertension. Just to name a few, very young onset, like less than 40 years of onset of hypertension, or very high blood pressure, like normal blood pressure is 120 by 80 millimeters of mercury. So episodes of very high blood pressure, like more than 180 by 100 or so, or hypertension in coexistence with hypokalemia. So normal potassium level is in the range of 3.5 to 5.5 millimole per liter. So if you are hypertensive and by chance if you get your blood tested and potassium is low, the chance of an secondary cause like endocrine hypertension is very high. And if there is a history of young onset heart disease or paralytic episode in your family in multiple members along with young onset hypertension, the chance of secondary etiology of hypertension also will be high. And in addition to that, there are certain other symptoms which suggest towards an endocrine cause, like in Cushing's disease or Cushing's syndrome, wherein the cortisol is excessive, a sudden weight gain along with new onset diabetes and hypertension, easy bruising, and difficulty to get up from sitting position. These are the usual symptoms of Cushing syndrome. Or in case of excessive growth hormone, there will be a prominence of or enlargement of our hands and feet with coarsening of facial features, increased sweating. So these are the situations where we need to think of so some hormonal problem is increasing my blood pressure, and in these situations you need to consult an endocrinologist. So thank you for watching. Hope this video was informative.